Right atrium. Right atrium is somewhat quadrilateral in nature, which is situated behind and to the right side of the right ventricle. Right atrium is elongated vertically, which receives superior vena cava in its upper part and inferior vena cava in its lower part. It has an outpouching called auricle, which covers the ascending aorta completely and infundibulum of the right ventricle partially. Shallow vertical groove called sulcus terminalis, which is present at the right border and extends between the superior vena cava to the inferior vena cava. In upper part of sulcus terminalis corresponds with the crista terminalis, where the SA node is present, sinoatrial node. Crista terminalis is a line which divides smooth part and a rough part. Smooth part is sinus venerum, which is developmentally derived from right horn of sinus venosus, and a rough part is derived from primitive atrium. Rough part represents the ridges called musculi pectini. The smooth part receives all venous channels of the heart except anterior cardiac vein. Septal wall is developmentally derived from septum primum and septum secundum. This fossa ovalis, which is derived from septum primum, and the ridges anterior and lateral, upper and lateral ridges, those represents limbus fossa ovalis or annulus ovalis, which are derived from septum secundum. Triangle of Koch, a triangle area bounded in front by the base of septal liplet of tricuspid valve and behind by the anterior margin of opening of coronary sinus and above by the tendon of toroid, which is known as triangle of Koch, it is a location for AV node. Opening in the right atrium. Opening for superior vena cava. It has no valves which receives the blood from upper part of the body, and inferior vena cava. It has a valve known as valve of inferior vena cava, which receives the blood from lower part of the body. Valve of inferior vena cava is also known as Eustachian valve. Opening of coronary sinus, which drains the blood from the heart. It is guarded by the rudimentary non-functioning valve known as Thebesian valve. And another opening is tricuspid valve, through which blood from the right atrium goes to the right ventricle. It is the largest valve that is present in the right atrium, that is known as tricuspid valve. And even it has a small openings for vein. In embryonic life, this fossa ovalis, which is open and it is closed after a birth.